Today, the Med Reconciliator and Dr. Chaos will focus on NPSG 030601 of the National Patient Safety Guidelines. This guideline was developed to maintain and communicate accurate patient medication information. It is used in several settings, including transitions of care within the hospital institution. Let's go over a scenario of what and what not to do with medication reconciliation forms. Miss Norma Jones, a 75-year-old female, is brought to the emergency room via an ambulance presenting with a broken hip. Let's see how Dr. Chaos handles the situation.
Hi, my name is Dr. Chaos. What happened to you?
Well, I was going to the kitchen to get some popcorn and I fell and I couldn't get up like that lady in the commercial. And so I pressed my button and the ambulance people told me that I broke my hip and it hurts a lot.
Alright, well, we're just going to start her with some morphine IV. Stop.
Shouldn't we take a med-rec form?
Who cares what they're taking? We don't have time for this. We'll just figure it out later.
Now let's see how the Med Reconciliator correctly handles the situation by including aspects of NPSG 030601.
I'm the Med Reconciliator. Before we initiate therapy, we should complete a Med Reconciliation form. On that form, you need to include both the prescription and the over-the-counter medications that the patient is taking.
Okay, so with that said, I'm just going to get some information from you if that's okay. Do you have any allergies that we should be aware of?
No, honey, I don't.
Okay, thank you. I think this other nurse wants to ask you some questions.
I just wanted to know what medications you're currently taking, any over-the-counter medications?
Well, I'm taking the multivitamin and the baby's aspirin.
Okay. Is that all that you're on?
Mm-hmm.
Okay, thank you.
Thank you.
Dr. Chaos is back.
Alright, continue her on the morphine.
Well, this patient just had surgery. Shouldn't we review the med-rec form from the ER?
No, that just takes too much time. She just had surgery and I have an order for morphine. Let's load her up on that good stuff. Yeah.
The Med Reconciliator has spotted chaos.
Med Reconciliator on the scene. So this patient was just transferred from surgery to the ICU. In transitions of care, it's always important to make sure that you compare the med-rec form to make sure that the drug name, dosage, and the way it's going to be administered is correct.
This patient just had surgery and has an order for morphine. Should we take a few minutes to update her med-rec form?
Sure, but it looks like the ICU has made a mistake on the medication form, and it looks like it's missing the metoprolol prescription, which is on the ER med-rec form. Let's give them a call and see what's going on.
Sounds like a good idea.
Okay.
Dr. Chaos continues to lead the healthcare team astray.
I can't be bothered with that form.
Yeah, you're right. She's on all that same stuff, so why don't we just go ahead and skip it?
Alright, well that just saves us some time, so that's good.
The Med Reconciliator has returned to bring the team back on track.
Dun 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 dun! Med Reconciliator on the scene again. Now, the patient was just transferred from the ICU to the inpatient setting. Now, it's always good to double check the med-rec form from one transition to the next. This is the time when most of the incidents or adverse events or mistakes happen, so it's always a good time to check and make sure that the med-rec form is accurate and current.
Well, let's look here. Looks like the patient was started on gentamicin while in the ICU, 500 milligrams IV, but I don't see it written here.
Let's call the doctor to confirm whether or not this medication, this patient should still be on this medication.
Okay.
More trouble from Dr. Chaos.
Get this lady out of here. I'm tired of looking at her.
Here's a list of medications that you're supposed to be taking when you go home. Just follow the directions and take all of them. Feel free to share with family and friends.
Okay.
The Med Reconciliator swoops in to clean up the mess.
Med Reconciliator on the scene once again. So this patient is being discharged from the hospital, so it's always a good thing for the staff to go over the med reconciliation form so the patient understands why they're taking their meds and to prevent any adverse events from happening.
Alright, so here's your form, and I'm just going to go over it with you. Make sure that you take your multivitamin every day. Take your aspirin, 81 milligrams every day. Take your blood pressure medication, which is your metoprolol, every day. And that will be the medications you'll be taking when you go home.
Do you have any questions for us?
No, honey, you've been very helpful.
Okay, and make sure that you always keep a medication list up to date with your doctor's office so that they are aware of the medications you are on.
Okay, thank you.
Why, thank you, Ms.
welcome.
Jones.
For review, here's a summary of the elements of performance for NPSG 030601. First, you want to obtain and update the information on the medications the patient is currently taking. Then you'll define the types of medication information, including the name, dose, route, and frequency. You also want to compare the medication information the patient is currently taking with the medications ordered for the patient. You also want to provide patient or the family with written information on the medications the patient should be taking when leaving care. And lastly, you want to explain the importance of managing medication information to the patient. With medication reconciliation, one is able to identify and resolve discrepancies, leading to better patient outcomes. And here's a tip from Dr. Chaos.
Remember to follow these medication reconciliation guidelines and avoid chaos like me.
Okay. I'm cured!
Med Reconciliation.
Con los terroristas.